welcome back if you have joined us for the first two presentations of the day. And for you who are just joining us now, welcome to the day 3 of Preemie Power Week. I'm Fabiana Baquin, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Power Week is the second of 2 international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, FCAN, and GLANS, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. And I would like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Preemie Power Week. And we are going to continue with the COVID-19 information and research that is happening around the world. And right now, we're going to talk about NICU Fathers and COVID-19, an international study. Dr. Nancy Phillips is a member of Finesse, an international group of neonatal clinicians and researchers interested in fathers' experience in the NICU. The group has an international study underway to learn about fathers' experiences in the NICU during the COVID pandemic. Her presentation will describe the online study and hopefully some of the preliminary findings related to the challenges fathers have confronted this year. Dr. Nancy Phillips, sharing the screen here with me right now, is an associate professor at the Ingram School of Nursing at McGill University and senior researcher at the Lady Davis Research Institute of the Jewish General Hospital in Montreal, Quebec. Her research focuses on the psychological adjustment and parenting of mothers and fathers of newborns requiring neonatal intensive care. This work is relevant to the current preoccupations of neonatology, the central role of parents in their infants' care and promoting parental mental health. Dr. Feeley, thank you so much for joining me here today. I am so honored to have you here with us. I follow your work for a few years, and I'm so grateful that you are here with us this week, sharing your knowledge and expertise.
Good afternoon, Fabiana. Thank you very, very much for your invitation. I'm really very delighted to be part of this panel of experts that you've put together this week. I've been listening in every day, and every one of the presentations has been absolutely fabulous. And I've been really blown away, so impressed by your program that you've put together, but also your expertise in managing all of this. You've been running a TV production for 3 days. So thank you very much for all you're doing. And I know that at my particular institution, there are staff and parents who've been tuning in. So thank you on all our behalfs. You've managed to make something special of Prematurity Week when there really wasn't too much that we were able to do. So thank you.
Thank you. So I will let you share your presentation. And for all of you watching us at home and the hospital, please send your comments and questions. We're going to address them at the end of Dr. Phillips' presentation.
Okay, so today I'm coming to you from Montreal, as Fabiana said, and my clinical appointment is and as a researcher is at the Jewish General Hospital. And I just want to give a shout out to the staff there who care for babies every day during this pandemic, and all that they do for babies and their parents, and all that they do for me by supporting the studies that I conduct there. So thank you. So I've been involved in the study of fathers for some time because my particular approach to practice and research is to consider the whole family. And we know now from 4 decades of research that are showing us that, father involvement has an important impact on the development of their children, their social development, their emotional development, and their cognitive development. And that fathers' contributions or impact on their children is not the same as mothers. I mean, there are some elements that perhaps overlap, but they do make important, unique contributions, their involvement to the development of their children. And this impact is important for their child, but it's also important for the father and his well-being and his role as a father. So in previous studies that have been done by myself and my students, as well as by other researchers, we really are finding out, discovering evidence that involvement in caregiving during the NICU hospitalization is really essential to the development of fathers' parenting sense of competence, how capable they feel as a father of being involved and contributing to their infant's care and development. Involvement in decision-making during a NICU hospitalization is also a very key form of involvement for fathers. And we've learned also that eye contact between father and infant and feedback from their baby when fathers are interacting with them or in contact with them is very important and critical features of how fathers and infants develop a bond and how fathers develop a sense of themselves as a father. So studies by myself and my students, as well as by other researchers, have really come to understand the importance of this contact or this closeness that occurs in the context of a NICU hospitalization, and how important that is for fathers to develop that bond with their infant and to feel like a father. So one of the things I wanted to highlight, and I didn't have in my presentation originally this week, but while listening to some of the other presentations, I feel that I wanted to include it. And it's this growing knowledge that we are accumulating on what's called the neurobiology of parenting behavior. And I've just cited some of examples of some research that's been appearing in the last decade or so. And it's really pointing to the fact that the neurological and physiological systems of parents and newborns are in communication. There's this interplay going on between them. And what we see is that infant behaviors, whether that be looking at their parents, making movements towards their parents, prompt physiological processes in parents, both mothers and fathers. And that this contributes to the development of the relationship between the parent and their newborn. It stimulates the parent's neurological system and promotes a sense of parental well-being as well. Other evidence points to the importance of visual or auditory cues that babies emit. So baby behaviors, baby eye contact, baby cries are activating regions of the parental brain that we know are coming to understand are implicated in parental behavior. And as I'm sure most of the audience knows, we have this evidence about the importance of skin-to-skin contact and how that's associated with decreasing parents' level of cortisol, their anxiety, and promoting parental well-being. So work by some of the researchers that I have cited here and others is really pointing to the importance of physical closeness between parents, fathers, mothers, and babies, and the importance of that for developing the parent-infant connection. So since 2018, I've been part of a group of researchers and clinicians called Finesse. And we were brought together by the gentleman in this photograph here, Duncan Fitcher. He is not a healthcare professional, but he is somebody who runs a nonprofit in the United Kingdom and who is concerned about parents, but in particular fathers. So what he did was he contacted a number of different researchers from around the world who are studying fathers in the context of a NICU hospitalization, and brought us together to look at the evidence that existed to date on fathers in neonatal in intensive care units, and really put forth some recommendations for how we could further develop and pay attention to the needs of fathers in the NICU context. So we put together this paper, and it appeared in the Journal of Neonatal Nursing in 2018. So that's the group that I'm part of that's now moved on to develop a study of fathers during COVID. So as everybody has been talking about this week, there were restrictions that were put in place in units across the world. And, we know the reasons as to why these limitations on parental presence were put into place. There were concerns about safety of babies, families, staff, and the spread of COVID-19 in NICUs, wanting to protect the babies from infection, protect staff from infection, to ensure that we have adequate staff in NICUs who are very specialized caregivers who cannot be easily replaced, to care for infants adequately, and also in some settings, concerns about lack of protective equipment availability. So we saw, as many of your guests have already referred to, policies in terms of parental presence that were being enacted in units across the world that varied greatly across countries and varied greatly even within countries. And this was difficult for parents to understand, understandably. And it didn't seem to most of us that the variations in restrictions were based on rates of community transition or risk, or what was going on in the local context. So some researchers in a number of different countries very quickly, wanted to investigate and see what was going on. So we had a group from the United States led by Mahoney here, who actually sent out a survey to allot hundreds of units in the US mostly, but elsewhere in the world too, through the various associations and contacts that they had. And they had 277 units respond to this survey that occurred, I gather, sometime in March, because the paper here reporting the results came out in April. And this is what their picture told with respect to what was going on in these 277 units. As I said, most of the participating units were in the USA. 24-hour parental presence policy that existed in 83% of the units before COVID fell to 53% in March. Many of the units were restricting access to one parent at a time in the unit. And 25% were saying that only one parent could enter the unit for the entire stay of the infant. So immediately, researchers and clinicians such as myself are thinking about, well, what does this mean for fathers? It's quite likely that they will not be accessing the unit if only one parent is allowed to enter per stay. 5% of the units excluded parents altogether, and 2% even excluded parents if the baby was not doing well, and even in situations of palliative care. So this is a very sad and serious situation with respect to the portrait that it paints with respect to restriction on presence. Another finding that they had was that parents' participation in rounds also decreased from 71%, which was typical in most of these units pre-COVID, down to only 32% in March. So I know that, Fabiana, you spoke of the importance of your being able to participate in rounds at your son's bedside earlier this week. And, so what impact is this having on parents' role in decision-making about their child's care? So, as Bainter et al. And others have noticed, these restrictions and social distancing that are being, enacted in units across the world on parental presence has created great difficulties for families, with many, many ripple effects, of which we can only begin to grasp what some of these might be. And these, ripple effects would include effects on parents' level of stress, their anxiety, their sadness, their frustration, their relationship with their infant, their relationship with their partner, etc. So looking to fathers now, we know that in light of what was going on, there were already stressors on families in the NICU context, and now we have additional stressors on fathers dealing with older siblings at home, the fact that probably support from friends and family was less in the context of COVID because of restrictions that were going on in the communities at large around them, concerns about being able to commute safely to the unit to be present, even if they could be present, financial challenges, perhaps changes in their own employment that may be occurring as a result of COVID, separation from their infant, separation from their partner, and accessing information and participating in decision-making, which, as I mentioned earlier, are very, very important aspects of father's involvement during a NICU hospitalization. So in light of all these stressors that we were imagining that were existing for fathers, on top of the usual stressors that are inherent in a NICU hospitalization, we decided to undertake a study. We also put together a letter that was published by our group in BMJ Global Health in June, talking about our concerns about the restrictions that were enacted and their impact on fathers, infants, and mothers. And, you know, I put this particular illustration here of a feeling that we were making a step backwards in my presentation well before I listened to any of the presentations earlier this week. And it seems that almost every one of your presenters have mentioned this feeling of a sense of falling backwards and, you know, regressing in the progress that we've made with respect to parents in the NICU context. So, you know, we argued for looking at the rationale, the underlying evidence that was leading to these restrictions and raising concerns about the many impacts these might be having, those ripple effects on fathers and their infant and their families. So this is our large team from Finesse, and we then put together a survey that we launched. We were able to launch in July 2020 this year. It's an online survey and it's currently active, and we're continuing to invite fathers to participate in this survey so that we can understand what the impact of COVID and restrictions that are occurring or not occurring, but just COVID in general, on fathers in the NICU context. So this study, survey of fathers, is being led by one of the investigators here, Esther Adama, who is a nurse researcher in Australia, working with this team of clinicians and researchers from many different countries, all included in the Finesse group. And here you see that I've inserted links here to LinkedIn and Facebook links that can be used to access our survey. If there are any fathers out there, we're hoping that you will participate in our survey. So what I'm going to do today is just tell you a little bit about the survey, what it involves, what we're looking at, and also just a little hint at preliminary results from certain aspects of the survey. So we are asking fathers to tell us about their exposure to COVID-19 symptoms, any diagnosis that's happening for themselves, their infant, or their family members. What are the restrictions that they've been subjected to during their infant's hospital stay? Any restrictions that were also put in place that are restricting their ability to interact and be with their partner at this time? We're asking them to describe the worries that they have as part of the hospitalization and as a result of COVID-19. We're asking them about their involvement in their infant's caregiving during this pandemic, symptoms of stress that they're experiencing, sources of stress. So what are the stressors that they're confronting? What support are they receiving and have available to them during this pandemic? And any support that was provided to them after they were discharged from the unit. So those are the types of questions that we're asking about in this survey. And it's typically taking fathers about 20 minutes to complete the survey, those have participated to date, and a little bit more if they have more to say in response to some of the open-ended questions that we've included. So to date, we've had 52 fathers participate. Most who have participated to date, 40 of the 52, are from the United Kingdom. And I think most of the audience knows that this is a place where restrictions on parental presence were quite evident and very restrictive. So it's not surprising. Plus, we have a number of team members from the UK, so they were able to elicit parental presence paternal participation early on in our survey. So, and then we have a few other participants from Canada, Italy, and elsewhere. But for the most part right now, most of the participants are from the UK, and we'd like to really see broader participation from fathers from other countries so that we can paint a portrait and describe what's gone on in different countries. The fathers who have participated thus far, most of them are between the ages of 25 and 44. About half, a little bit more than half, are having their first child hospitalized in the NICU. Most of them are married or cohabitating with their partner. This is interesting. 90% of them were employed full-time before COVID, but only 75% after the start of the pandemic. So here we can see some of our concerns about employment stressors that may be impacting on fathers as well, who are often the primary breadwinners during, postpartum. When we asked about fathers' experience with COVID, we saw that none of them had themselves tested positive. In one case, one of their partners had tested positive. And in one case, one infant had tested positive. So we're not seeing much actual COVID illness experience for fathers, infants, or their partners. Few of the fathers had actually even had tested or had contact with anybody who had tested positive. Some of them, a small percentage, almost 10%, had a family or friend hospitalized, and some had even experienced the death of someone close to them. So here again, we see some of the possible additional stressors that may be facing fathers during this pandemic. Here we've asked about restrictions, and you'll see that some fathers may have experienced more than one of these restrictions. So in case of 8 fathers, only the mother was permitted in the unit for the stay of the infant. In other cases, 2 fathers stated that only 1 parent per day was allowed in the unit. Limitations on the times that they could enter the unit or the hours at which they could enter the unit were restricted. And I think many of you might know that if fathers are employed, they tend to be in the unit at the end of the workday and into the evening. I know on our unit in the hospital in Montreal, they talk about the guys are here in the evening. And so if limitations are on actual times of entry, then fathers may be not able to be present at those times of entry. In some cases, they're only able to enter 1 time per day. So there's no going in and out of the unit. Once you go in, you can only come out that day and not return until the next day. So if you're obviously juggling other responsibilities and stressors at the same time, this may pose a problem. And so 24 of the fathers who responded thus far have told us that this was their situation. And in only 11 fathers' cases of the 52 that have participated thus far, were there actually no restrictions at all on their ability to enter and leave the unit. When we ask them about restrictions on their interactions with their partners, we see here that it's sort of equally divided, and that there were no restrictions on their ability to be present with their partner in almost 30% of the cases. And then some were having some restrictions and others no restrictions. Only about 1 in 4 fathers were not confronting any restrictions with respect to their ability to be with their partner. So obviously those kinds of restrictions are going to have an impact on the support that fathers are able to receive and also the support that mothers are able to receive. We asked about restrictions on other family members entering the unit. And as you can see, restrictions on entry of others into the unit are very, very common, with grandparents not being permitted to enter in almost 90% of the father's cases, and siblings not being able to enter the unit in almost 80% of the father's cases. Then we asked fathers about the top 3 sources of stress due to COVID-19 now. And you can see that for 35% of the fathers, their main source of stress was the impact on their baby. What was this situation of the NICU hospitalization in the context of COVID and parental access perhaps being limited? What was that impact going to be for their baby? They were also preoccupied, 25% of them, with the impact on their partners. They were also concerned, about a quarter of them, with respect to the impact on their own general well-being during this time. And also concerned about impact on family members at large, whether that be siblings that might be at home, grandparents, and other extended family members. So what I'm hoping going forward is that we really have a more evidence-based approach to decisions about presence, being very mindful of the need for family-centered or family-integrated care, and also a respect for and an understanding of the evidence about the importance of parent-infant proximity for both mother and father. I think we need to develop and communicate policies very clearly and transparently with a solid rationale for why decisions are being made about presence of parents in our NICUs. And we need to use, as many of our speakers have already talked about this week, novel approaches to keep families in communication with one another and with the staff in the neonatal intensive care units as well. And look at innovative ways to provide support to families in the context of the COVID pandemic. Now, many of you, or some of you may know that in recent years, there's been increasing numbers of father support groups or father group activities on many NICUs in many countries across the world. This one in particular is called Special Care Unit Dads, and Matt Cray here in the photo below, he is a nurse from this unit in Newcastle upon Tyne in England. And Matt is really the driving force behind this particular group. And here you see in the photo a group of dads that are meeting. And, you know, they were able to do this, and they've been doing this now since 2017, having monthly group meetings and expanding that program to include former dads of premature infants cared for in their unit who are providing support to dads who are currently in the unit. And so all of this was, you know, rapidly moving forward and developing and really providing an important source of information and support for fathers whose infants were currently in the NICU. And unfortunately, you know, they weren't able to go and continue when COVID hit. But, you know, Matt and his group very quickly moved on to Zoom and are now doing this virtually. So here we see an example of, you know, being able to continue to support parents in the context of the COVID pandemic and meet the needs of fathers in particular who may have particular challenges that they're facing because of decisions that units are taking about access to their units. So what I'd like to do today is invite fathers to participate in our study and share what your experience has been like if you are the father of an infant that's been hospitalized during the pandemic. Our survey is available online, and I'll tell you about that, how to access it next. It takes most people about 20 minutes to complete it. It may take more if you have a lot to say and tell us in response to some of the open-ended questions. And if you have a lot to share with respect to your own personal experience during the pandemic, we'd like to hear about it. So we're we're a team of international researchers, I think, as you saw before. So you can complete the survey in English, you can complete the survey in Italian, and you can complete the survey in French. So those are the languages that we currently have available to us. And here are the links to the survey in various platforms where you can, connect up and tell us what your experience has been like during this pandemic. There's the French version by one of the French Francophone researchers from France on our team. And I want to thank you, Fabiana, for putting together this amazing week of presentations. It's been wonderful to be able to have an opportunity to mark, World Prematurity Day, given that, we're not able to do the usual things that we would do on this day in our own centers. So thank you for giving us this opportunity to get together and to share knowledge and to learn about parents' experience during this pandemic.
Feeley, what a great presentation. It's so very important to include dads in this conversation. And the stories we've been hearing are absolutely heartbreaking. I don't know if you watched Laurie Romans, this parent from Northern Ontario on Monday, who got transferred to Winnipeg, and her husband could only meet the baby 37 days after the baby was born. He was not allowed to cross the border of the provinces because of the pandemic. And we can hear even like in other units in Canada where they only allowing one parent at a time, even when baby is in palliative care. And we had a few cases that baby passed away and only mom was present at a time, which is absolutely devastating. So my question to you is, considering that fathers are not present in those moments or in the care at all with the baby during the NICU or reduced hours in the NICU, what do you see the implications on long term for the fathers and the moms?
Well, that's a really excellent question. And, we don't know, because this is a really unusual circumstance that most of us have not encountered before. I think that we have a lot to learn about that. There are, definitely some units that are using novel technologies or whatnot to be able to connect parents and babies. So we really don't understand all of this. So that's an important question, but one that's difficult to answer.
So from your experience work with dads for many years in research, we know the impact on dads in the NICU. We know there is more PTSD on dads, or dads cope very different than NICU than moms do. So you know that impact. How can we at this time create more support for fathers? Because if they're worried about their jobs, you show in your statistic that dads lost the jobs in the pandemic. So that is obviously a main source of stress for fathers as they become the one breadwinner during parental leave in many cases. And I'm talking about Canada, where we actually have an extended parental leave period. So how do we see us coming together as a community to support the fathers?
Well, I think that we're seeing a growth in those support groups, such as that by Matt Cray. And so, participating in those kinds of support groups, if you have access to it, Matt's operates out of the UK, but I know that there are others in other countries around the world. I think that units could be even setting up opportunities for fathers to get together virtually on various platforms that we have available to us. So, that may help. I see this as a sort of a second option. It's not obviously ideal, but in the context of what's going on, we need to make the best of it and optimize opportunities. So using virtual platforms, I think, is not the first choice I would make, but that there are other options that we can employ. You can see how Matt, those dads in his units were meeting face to face, but they quickly moved over to Zoom and have been able to continue. It's not quite the same, but it's something that's still possible. Not ideal, but possible.
Absolutely. And I think fathers groups are very important. And sometimes I talk to my husband about it. If he would go to those groups, he said, if I had to talk about feelings, I wouldn't. But we're going to talk about, work and what is happening at work. And he still tells me the conversations he had with other dads in the unit that were not about their emotions and feelings and how they were processing the NICU. And I think that has to be a change in the way we think fathers need support, because we always come from the place of supporting emotionally. And sometimes daddies come together to watch a hockey game or drink a beer at the pub, which is a lot of fathers at IWK were getting together to go to the pub, and that was their way of supporting one another. So do we have to change the way we approach fathers to get them more involved and perhaps cope in a different way?
No, I don't think they need to cope in a different way, but we have to figure out how it is that they're coping and then support that. And so you can see that, there are groups that have been successful, such as Matt Cray. And, so it isn't about sitting around and sharing your feelings. So they may do things differently than the women may do if they were, coming to a mother's group. But nonetheless, it is supportive for them to be together because they're sharing an experience and sharing some time and sharing some tips on how to, manage in the context of their infant's hospitalization. So I think we need to respect their way of dealing with it and, provide them with a forum that works for them. And so that may be quite different than what mothers may require or what mothers may seek. And, certainly Matt and others have been very successful at rallying around fathers and figuring that out. And, his group is growing across the UK. So they've been able to grow that group, which is really nice to see.
Absolutely. And I think this is another topic. Another point that is very important to remember is initiated by a man, because sometimes it's like, okay, the most social workers in hospitals are females, and it's a different relation when they go to a father's group where it's run by a male doctor. This is what I've seen around. The more successful groups are the ones like Dr. Macmillan and IWK and another father that was running there.
Yes.
For Jonathan Foster, who runs the group, it's Michael Guerin. So I think having this father figure running the groups is very important. If any hospital is here listening to us to how to start and engage fathers, I think it has to be that initiation from a different point of view.
Yes, I agree that the leaders that have been successful, like Matt is a neonatal intensive care transport nurse, but he's a father. And then, he participates with a neonatologist who's male as well. So I agree that, having the involvement of staff who are men, working with fathers is probably obviously more conducive to actually getting these things off the ground, because, they're better able to relate to one another and understand one another's experiences. So, and do things in a different way. It doesn't have it, what fathers want isn't necessarily what mothers want. And we have to understand and respect that.
Absolutely. We have a hello from Spain, from Madrid. And also we have a comment from Karen Beatty. She runs family groups at McMaster. And she said, our dad's pizza nights were very successful prior to COVID. And I'm hoping we can resume that in the near future. But Dr. Feeley, when are we going to have some preliminary analysis of the data you've been collecting?
Well, we're hoping to have more participants during this second wave. So, as I presented, who's participated so far, it's primarily fathers from the United Kingdom. And I would please encourage fathers from Canadian units, especially those that have restrictions or challenges in place, from participants from all over the world. We're hoping to have an international group of fathers who are participating in our study. I showed you all of the links, the different ways that fathers can access the survey. It only takes about 20 minutes, and we're hoping to have many more participants through this second wave so that we can really understand the challenges that fathers have faced worldwide and can share that with you at some later point in the new year.
Absolutely. And we're going to continue to disseminate that survey, hoping to get more fathers to answer those questions. And yes, we are people ask if you're sharing the link. Yes, we are sharing the link on our comments, and it is in English, French, and Italian, and as well as your Facebook page. Dr. Feeley, thank you so much for joining us here today, for sharing your knowledge and expertise with us. And I'm really looking forward to see the results of your research next year, and hopefully can implement some of the change that will come with the recommendations from your research. So thank you so much for today.
Thank you for your attention to fathers, Fabiana.